A huge factor in even having this conversation is just normalizing talking about using drugs, normalizing having the conversation about risky drug use or what could happen as a result of using drugs. Not just don't use drugs, but why or what could happen if you do. Not just you could become addicted or that could be problematic for you, but you could overdose, whether you know what you're using or not, or that you just might not know. It might not be safe. So having that conversation can also change the stigma around the way we view people who do use drugs. And being able to have that conversation and normalize that conversation can change the stigma that we as a society hold towards people who use drugs. And if we can change that stigma, we can help encourage people. We can help give them hope. We can help encourage them to come in to treatment spaces like a clinic or to pursue treatment, say in a residential treatment facility, where they can pursue recovery if they're struggling with substance use. But just having that conversation makes it safer, because even people who aren't addicted to substances, even people who are just curious about using drugs or feel peer pressured to use drugs, can understand what those conversations really need to be about. Not just, I shouldn't use because that's shameful or because there's a negative stigma towards it, but I shouldn't use because it could be dangerous, because I don't know what that is, and that could be something that I could overdose and die on. But being able to have those normal conversations and being able to allow people the space to be open about it can change the entire narrative around just talking about drugs as a society and helping people be safer, but not just to be safer, to pursue treatment if that's their goal, but most importantly, just to have hope that they can get better if they're struggling, to have hope that they can help support a friend who needs help. I think just being able to normalize having those conversations is so important.